My name is Trish Ware, and I am obsessed with all things pregnancy and birth, and helping you to navigate both the practical and the magical seasons of this journey called motherhood. I'm an all-day coffee-sipping mama of 7. I've had the amazing privilege of delivering many babies in my 15-plus year career as a labor and delivery nurse and as a mama of 7. I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby. Quick note, this podcast is for educational purposes only and does not replace your medical advice. Check out our full disclaimer at the bottom of the show notes.
Hello. Hello. Wow. Queen Mahala asked me, which part of labor is the most dangerous? You know what part of the labor is the most dangerous? Is the part that you're not educated for. The most dangerous thing about labor is an uneducated mama who does not understand what's happening inside of her, around her, and allows other people to make the decisions for her. That is the most dangerous part of labor. Hi, can I ask if it's normal to experience frequent Braxton Hicks in 6 months of pregnancy? I love the terms, is it normal? Because we have such a wide range, a vast range of normal. But yes, it is normal to an extent. But here's what I would tell you guys to do. We all experience Braxton Hicks, from one degree to the other. The more babies you have, the more Braxton Hicks you have. It's kind of like your uterus is like, hello, what's happening? So Braxton Hicks, for those of you guys who are listening, are just basically practice contractions. Your uterus is a muscle. It is the most powerful muscle in the world. Sorry to all my gym bros who go and work out all the time. Uterus has got you beat. Your uterus will do these practice Braxton Hicks, and it's these like little squeezes in the middle. The thing about Braxton Hicks is they're usually just in the tummy. They don't go down to your legs. They don't radiate to your back. They're only in the middle of the uterus, and they're like, hey, I'm practicing and getting ready. Now, if you find yourself having a lot of Braxton Hicks, my very first thought is you're not drinking enough fluid. So what we recommend to our students and our members inside of the membership is increase your fluids and maybe do some like liquid IV or coconut water, or if you have to, something that has a lot of preservative, which is like Powerade or Gatorade. All right, next question. 25 weeks as a first-time mom, excited to be part of FB. What causes some women like me to have too much amniotic fluid? The baby. That's the culprit. So your baby is actually the one who produces the amniotic fluid. Did you guys know that? Your amniotic fluid it comprises of urine and fetal matter and all the different stuff that your baby is actually producing. So sometimes it can be a sign of some sort of like kidney issue with baby. Usually it isn't, but it can be. So unless you are actually diagnosed as polyhydramnios, which is a lot of amniotic fluid, you shouldn't have too many side effects. The one thing that we worry about when you have polyhydramnios is it's putting too much pressure on that uterus. And then when contractions start, you've got all the pressure from that enormous amount of fluid. I actually had polyhydramnios with Gavin, my boy number 4. What vaccines are given to newborns on delivery day? So while you're in the hospital, I did this class last night, the first 48, and I talked about the newborn medications. So there's actually 3 medications. They're not all vaccines. Only one of them are. But I want you to know, I think your name is Elle, that you get to make the decisions on how you navigate the newborn medications. Typically, within the first day, we're going to do them all. They've all got different ranges of when we do them or want to do them, should I say, because you get to decide. So the first one is the vitamin K shot. The vitamin K shot is needed or not needed. It's your choice. Some cultures do not do it. They avoid it. It's your choice. The vitamin K is given because that's better than needed, right? Given because babies they cannot clot the way that we can. So if they have some kind of trauma during their delivery, maybe we did forceps or we did a vacuum, or they hit the pelvic bone running and you get a really fast delivery, which we call a precipitous delivery, they might need that vitamin K more so than a baby who had a nice, slow, steady birth no trauma. However, if you don't do the vitamin K, I would definitely say if you're making choices like a circumcision, do not do that until day 7. I think they start, and I might be wrong because I'm lacking sleep right now, but I think around day 8, 9 is when they start producing their own clotting factors. So a lot of cultures, they don't do circumcisions until then. They don't do any kind of things until then to prevent. The next thing that we do is the erythromycin eye ointment. It's a little tube of ointment. We squirt it in the baby's eyes. I always say, if you're going to do it, tell your labor nurse you do not want it until after those first precious hours, because part of what I taught last night is that the baby is using all of their senses to acclimate to this world, and they all rely on you. So we want the baby, they can only see about 8 inches or so. So we want the baby right up close to you on your breast. And there is something called the newborn gaze that happens between a mom and a baby that is insanely gorgeous, like insanely gorgeous and amazing. And we don't want to miss that, right? We don't want your baby to miss that. I always, once my moms deliver, I always dim the lights so that the baby's eyes will pop open because they're in this newborn alert stage, this awake alert stage. So avoid the erythromycin. It is given because back in the early 1900s, all of these babies were going blind, and it was linked to gonorrhea and chlamydia. So if you have been tested for sexually transmitted diseases, if you don't have any kind of funky infection, and GBS does not count, even though some people will argue with me, that's okay, I don't care, then you really don't need it. If you have a committed partner or you're not having sex at all since the last time you were tested, or we know that you don't have one. It's not necessary, but again, it's your choice. Here at Labor Nurse Mama, we believe in laying out all the things and letting you pick and choose. That's what makes my birth classes different than anyone else. Yes, I'm a labor nurse. They say that I'm a crunchy with a side of medical, but I lay all the choices out for you and let you pick up the ones that you want and lay down the ones you don't. The third medication that we give your newborn is the hepatitis V vaccine. It's the first of a series, and they like to start it in the hospital. I personally did not do that in the hospital for my own babies. I did a very long, drawn out schedule, which y'all know I don't talk about this online because I'm sure I just messed up and I'm going to get a lot of hate DMs, but that's okay. You choose what you want. You can also delay to starting it at that first pediatrician appointment, which usually happens the day after you get out of the hospital. Hi, I just found out I'm 5 weeks. Congratulations! Congratulations, congratulations. That's so amazing. I am so glad you found us. It is not a coincidence that you're here. So I was wondering if it's okay to get my hair colored. So there is mixed opinions about this. If you're going to get your hair colored, there are toxins in it. So I would avoid doing it during the first 5 weeks. However, there are some really healthy natural hair products that you can color your hair. So talk to your hairstylist and maybe even consider doing it yourself right now, temporarily, with a more natural hair product. But again, do your research and make a decision that's best for you. Can you feel if baby turns to a head down position? So if it's happening slowly in a natural process of how it's supposed to go, typically no. You may feel the result of it because suddenly you can breathe a little better, but you have to pee all the time and you feel a lot of pressure on your vagina, on your pelvis. But feeling the actual turn usually doesn't happen in a one big movement when it happens around 32, 33 weeks. That being said, if your baby was breech and then goes head down later in pregnancy, you might feel that big movement because it's pretty big. It also depends on how many babies you've had as well. Because for someone like me who's been pregnant 9 million times, at the end of my pregnancy, my babies, they have enough room to go wherever they want. So I feel them all the time. We are answering pregnancy and postpartum questions. I also have a 10-month-old, so I thought perhaps it's because the pregnancies are close together. I thought that might be a factor. It very well could be because your uterus knows exactly what it's doing. And like my midwife says, the more babies you have, the more stretched out it is. Like a rubber band. You know how you have a hair bow and you keep using it and finally it's just too stretched out? That's what she said to me. I don't think that was very nice though. So apparently I have a very stretched out rubber band of a uterus from having so many pregnancies. I'm in early labor and I feel like it's lasting forever. Any advice? I would say do the mile circuit. We have a modified extended one that we teach our girls that my doula Lene created for us. She's incredible. She is like the magic position queen. The other thing that you can do is squatting, sitting on the birth ball. I really hesitate to tell you too many positions because it's very important that you learn how to use your pelvis. So we teach you guys before labor starts how to open up the inlet. That's really important because the real crux of labor, of a good flowing, easy, calm labor, is that baby getting down into the pelvis. That's the magic of it all. We all think, oh my gosh, how far dilated I am. That's really not the magical part. The dilation won't happen if the baby's not putting pressure on your cervix. So we want to teach you, and this is why we created this guide, which you can get it for $7 on its own. It's not as powerful as if you have the classes because I teach you the rationale and we help assist you, but you can get it on its own. I think it's still $7. I might be wrong, so don't hold me to that. But if you buy the guide, you can print it out. I recommend you print it small and then laminate it for all your pregnancies, put it on a ring, put it in your hospital bag. That way, when your nurse comes in and she says you're -2 station, you can look at the movements you do. If you don't know what station is where the baby is inside of your pelvis or outside of your pelvis. Okay. Is it possible my partner is experiencing Braxton Hicks contractions when she feels like she needs to poop, but doesn't? She's 39 weeks today. Two things I want to say. Yes, 100%. 100%. This is why, you guys, right here, this confusion that comes along with pregnancy and birth can be alleviated with knowledge. And I really recommend, my class is a little different in this as well. I recommend that your partner and your birth team, whoever's going to be in the room, family or friends, does the classes with you so that they know how to navigate these kind of things as well. So more than likely, she could be having early labor. I want to say that as well. But Braxton Hicks do get stronger towards the end of pregnancy. And what's probably happening is those Braxton Hicks are pushing the baby down, and the baby might be putting pressure on her rectum and her colon. Tell her to hydrate. Any advice for fast labors? First was 4 hours total. Midwife says this one is likely to be faster. Your midwife is probably 100% correct. Fast labors it's funny. Everybody's like, I wish my labor was faster. But too fast of labor can also be a little bit traumatizing. And it's like, what happened to me? And so there's not much I can say to slow your body down. However, I would say to work on your mindset, have everything prepared and ready. And you might want to go to the hospital. If you're delivering at the hospital, you might want to go to the hospital a little bit sooner than other second-time mamas. We recommend when your contractions are less than 5 minutes apart, each one lasting for 60 to 90 seconds for 1 hour for our second-time moms. Our first-time moms, we have a totally different rule. It's less than 4 minutes apart for each one lasting 60 to 90 seconds for 2 hours. So if you are a second-time mom, you go by the 511. But for someone like, I think your name is Jade, for someone like Jade who has very fast labors, which I do too if I go in spontaneously, then you might want to head in a little sooner. Maybe when your contractions start to really declare themselves, maybe they're less than 10 minutes apart for an hour. Or your instinct, your gut tells you. Where should you feel baby at about 25 weeks? So at 25 weeks, you're going to start feeling the baby down lower. I don't remember exactly when off the top of my head, but you're going to feel those flutters all around that uterus because they can kind of flip around. So depending on how big your tummy is, find the top of your uterus and then you can kind of feel around and sometimes feel that little lump in there. Can the newborn gaze happen when an epidural or C-section, do you think? Yes, it absolutely can. But again, this is why I have my mamas in their birth plan put in to minimize interruptions, minimize outside talk. You don't need the team talking about their weekend plans or anything like that. You want that room to be quiet and centered on that baby because, again, another one of their senses is their hearing. So we don't want to disrupt that. So yes, it can with an epidural. It absolutely does with epidurals. And it can with a C-section. as long as we get the baby to mom. And the problem with the C-section is we can't really dim the lights in the OR. I had early contractions all day yesterday until they were every 4. I'm guessing you didn't deliver. Maybe you did. I could be wrong. The difference with real contractions and what we tell our moms is they will declare themselves. So I said every 4, but I also said lasting 60 to 90 seconds. So if you're having these little putsy poo, I call them putsy poo. That's the official term. You'll find that in labor and delivery books. If you have these little putsy poo contractions that are like eek, eek, not lasting, maybe they're lasting 20 seconds, 30 seconds, but they're not lasting 60 to 90 seconds. Those are not real contractions. Those are Braxton Hicks. And Braxton Hicks will go away. Real labor contractions, they stick around until that baby comes out because that's their entire job. Their entire job is to show up when labor happens. Come hell or high water. Any pointers for mamas that have to be induced? Yes, we have a lot of education and advice for that as well. Again, you need to know what you need to know. I say this all the time. If you don't know your options, you won't have any. You need to know the options so that you can navigate that process because you can make decisions along the induction process. You can make decisions like one of my team members who was a student at the time who told her doctor what she wanted and they changed the whole plan for what Ashley wanted. You get to navigate those decisions. You're going to be made to feel that you don't have all the rights that you think you should have, but you need to know what you can say yes and no to. We have another little motto. We say, you can refuse anything, but should you? You don't ever want to refuse or accept anything without knowledge. Knowledge is power, and you want to be the one making the decisions, not someone else. Educate yourself. 2, help make the choices on what sounds reasonable to you during your induction. 3, do not let them break your water no matter what they say, unless you're in active labor or at least 5 to 6 centimeters in active labor, right? Active labor is usually past 5 centimeters. Sometimes there's some exceptions in the rule, but that's why you need to be educated. Number 4, remember that it's slow and steady. A lot of women during inductions will end up agreeing to a C-section because they're just stinking over it. But if you tell yourself this could be a 2 or 3 day process, you won't think, oh my God, I'm going in this morning, I'm having a baby tonight, because that probably won't happen, especially with the first baby. So if you go in there with the expectation this is going to be slow and steady, and I'm not going to have the baby today, probably in a couple days, and you're not setting yourself up for disappointment, you're going to have a much better induction. The other thing I would tell you is that your birth plans are not out the window. I had 3 very beautiful hospital unmedicated inductions. So it's very possible. 19 weeks pregnant. I have white discharge a lot. When should I do? What should I do? Stinging and burning when urinate. You need to call your provider right now. It sounds like you have more than likely a yeast infection, but it could be something more, but you need to have that checked out. You need to get that checked out. I would also consider starting to do some probiotics, maybe drink some, make sure you're increasing your fluids. Doctors worries baby is big and won't have enough room to move. Thoughts on that? I think it's mostly, more often than not, bull. Is not actually true. Big baby is misdiagnosed all the time. Ultrasounds are not accurate. Even palpating your abdomen is not always accurate. They say that ultrasounds are off by 1 to 2 pounds. And I can't tell you how many cesareans I've done for moms who've been told their baby was too big for a vaginal delivery and the baby comes out smaller and 6 pounds. And then the doctor's like, oh, well, you never would have been able to deliver this baby, which we call BS. 100% BS. I would not be induced. ACOG states that being induced for big baby alone is not acceptable. Having a C-section for big baby alone. Now, if you have other diagnoses along with it, it makes it a little more complicated. However, for my GDM patient or students and my moms who are diagnosed as bigger baby, we usually navigate that by not being induced. Is lower back pain common and normal after labor? Oh, again, is it normal? We say this all the time as women when we're pregnant and post-delivery. Is this normal? Is that normal? This is why we give all of our birth class students 30 days in our mama membership, because you think oh my gosh, I'm pregnant. Some of you guys don't educate yourself at all. Shame, shame, shame. But some of you guys think I took a birth class, I'm done, I've had the baby, I'm good to go, but you're not. There's so many changes in your body and there's so much to navigate for those first couple years. And we're in there to help you navigate things like, is it normal to have lower back pain? You know, some women complain of back pain due to the epidural, but remember that when I was telling you guys earlier, your pelvis is going to do all sorts of wonkadoodle things and open up. Your body releases something called relaxin at the end of your pregnancy for all of those things to shift. You just had a human come through all those bones. Yes, your lower back can hurt, but depending on your own situation, there's some exercises you can do. There's some things you can do to relieve that back pain, some stretches. I wouldn't do anything hardcore. I did not take the glucose test beverage. Was I wrong to refuse it? I would never, and I recognize you from some of my lives, I would never say you're wrong to refuse anything. I would ask myself, why did I refuse it? A lot of labor nurses, we don't do that drink. We do testing over 2 weeks. We test our own blood sugar. A lot of my students do that as well. Is there power in knowing if you're gestational diabetic? Yes, for sure. So if you refuse that test, I would be checking your blood sugars just to make sure, because there can be so many complications from undiagnosed and untreated gestational diabetes that we don't want to happen. So I would say you need to know, but you don't have to drink the drink to find out. Pitocin after birth, is this something you have to get? No, you can, like I said before, you can refuse anything. However, the rationale that we give Pitocin after delivery is that it can stop or try to stop or help prevent a postpartum hemorrhage. Postpartum hemorrhage is one of the leading causes of death for mamas during postpartum. So we don't want to take that lightly. I'm not some kind of person who's don't do anything. You don't have to add anything. Interventions, they're all bad. No, I'm a labor and delivery nurse. I believe in interventions when they're necessary. Now, if I went in to have a baby, I am very high risk for a postpartum hemorrhage because I've had a butt ton of babies. So yes, I'm going to accept it. But what I was telling the mamas, I think last night, is that there's options. You don't have to get the whole bag. You can just get an injection in your leg, which is just the Pitocin. So you're not getting all that extra fluid on board, because all that extra fluid it can cause some issues. But if you are low risk, your platelets are fine, you have no signs of postpartum hemorrhage, then no, you don't have to get it. You said yesterday in class that women get Pitocin after labor and while you're waiting for the placenta to come out. Can you explain this? Yes. So it's actually after the placenta comes out. Most doctors. Now, there are some schools of doctors that do it waiting for the placenta, but typically a mom who has just delivered her placenta, we're going to give you a bolus of 500 mLs of fluid, which includes 10 units of Pitocin. So like I was saying, you can do that in an injection form. So you're just getting the Pitocin and not the fluids. But like I was just saying before, we do this to prevent a postpartum hemorrhage or to stop one. Can the vitamin K be given while the baby is on me, or do they have to take the baby somewhere? How long should we wait for them to give them? Everything just about that we do to the baby, assessments, shots, blood draws, can be done on top of you. So yes, if you choose to do any of those, if you choose to do vaccinations, if you choose to do vitamin K, erythromycin, the heel prick, you do need to do that. And we talk about that in the classes. If you do any of those things, that the assessments and the testings like the PKU, they can be done on top of you. That really helps, especially if baby's breastfeeding. So if baby's blood sugar has to be drawn, or we have to do blood draw on baby, have them laying breast here and legs hanging off of you. When the legs are hanging, it helps with that blood draw. All right, let's see. Had suction and episiotomy with first delivery. Will I need them again with my second, or will it be easier? So more than likely you will not. The path has been paved, if you get my drift. So when she says suction, she means the vacuum to help baby be delivered. 39 weeks, over 7-pound baby, first time, don't want to get induced. Recommendations, say no. If you are healthy and baby is healthy, you can wait for labor. You do not. I tell my students all the time, you don't have to be induced. You don't have to be induced. You can say no if you're both healthy. You are safe to go to 42 weeks. Some women go beyond. I get a little bit uncomfortable with that, but that's just me personally. That is not golden rule. It's up to you. I'm 4 centimeters dilated so far and haven't had constant contractions. Is this normal? Absolutely. I have a student right now who's 7 centimeters and not in labor. Can you imagine? This is the second time this has happened to her. She is a repeat offender with me, and she's got us on our toes right now. I need to check her labor bat signal because she just went to the doctor again. So you guys know, this is why I do what I do. For this mom who's 4 centimeters and not knowing what the heck to think, and I'm sure doctor's office is not giving her a lot of things except for if this happens, come in. If that happens, call. My aunt had an exam done at 17 weeks, and a few days later miscarried. Both her and her baby were healthy. You know, I'm not sure what kind of exam, but typically it's very hard to cause a miscarriage or a loss. So she really needs to sit down. If she's having any kind of like thoughts that maybe someone caused it, she needs to sit down with her provider. How to get my husband interested in this information before birth. He doesn't seem to care much. Have him come to, if you join my classes, have your partner come to the hangouts on Wednesday and we will get them interested. We will talk about how powerful it is for them to understand what is happening inside of you and around you, because during labor, your only job is to labor. Their job is to advocate for what you already made decisions on. So they need to understand. So if you say, I don't want a FSE, they need to know what is an FSE and why is it normally used? And is this an appropriate time to use one? If they don't know that, they're going to lean into anything the labor nurse, me, or the doctor says, because they're going to think we know more than you. But my students know as much as a labor nurse, and in some parts of labor, more than a doctor. I'm so sorry for your aunt's loss. Is the glucose test mandatory? It's not mandatory. However, it's wise to know if you're gestational diabetic. You want to know, but you don't have to do the test the way they're saying. That's something we teach our girls too. There's other ways to do it, even if they're telling you. I had gestational diabetes with baby number 1. What are the chances? Baby number 2, I've lost 50 pounds since having my first baby. Sammy, actually, you may not, and not just because of the weight loss. Some of my moms have not had it the second time around because they know how to eat smarter and they know their bodies. So you may not be diagnosed with it this time around. However, you do want to get tested just in case. And don't go into the pregnancy or don't be like fearful, because knowledge is power. So if you are, that's okay, and you didn't do anything wrong. Are there any other pain meds that you can accept during labor outside of an epidural? So we do a couple other things. Some hospitals offer the nitrous oxide. Some women love it. Some women hate it. It doesn't take away all the pain like a good epidural can. I say good because they don't always work. The other option is IV narcotics. However, if you've had a baby before, we're only going to give it to you till 6 centimeters. And if you've never had a baby, maybe 7 centimeters. However, IV narcotics only take the edge off. They don't take the pain away, and they usually only work the first dose. They just make you feel loop-de-doo. They don't really help with labor pain. Bad ball doesn't help. What do I do? So there's some different things that you can do, different positions. Number 1, I would tell you to consider wearing a pelvic girdle. The other thing I would tell you to do is to see a Webster certified chiropractor, and also to do some pelvic floor work with a pelvic floor specialist. 24 weeks, been feeling lots of pressure down there. That's very normal, Cynthia. I just did a live on Instagram with my followers over there, and we were talking about, is it normal? Probably the thing that you're going to ask the most during pregnancy and the first 2 years after baby, is it normal? This is why I give, if you guys join my birth classes, my full birth program, you get 30 days free in my membership. So you have access to me and doulas and other professionals so that we can help you navigate those things. At 24 weeks of pregnancy, it's very normal to begin to feel an increased amount of pressure. And at some point, you're going to think your vagina is falling out. I have a lot of pressure down there, but not labor pressure, can barely move legs a certain way. So you really need to talk to your provider and potentially see a chiropractor. They need to be Webster certified and a pelvic floor specialist. You should not be able to not move your legs. I don't like that. I'm 20 weeks, 4 days, was helping my husband pick up sticks yesterday, but my body's aching now. Very normal. Our body is just not its normal self. But as long as you're not having more than 6 consistent contractions per hour, I think you're fine. And one thing I would tell you for those achy muscles is to overhydrate yourself. So drink a lot of fluids, maybe do some liquid IV or some coconut water. Coconut water is like so disgusting to me, but it's also really powerful. Some of y'all love it. Contraction-like cramps at 25 weeks. Again, the most common cause is dehydration. So chug some coconut water. If you're having more than 6 per hour, you need to be seen. Can I choose how I'm induced? Yes. Yes, you can. You can choose how you're induced. You can navigate that. I want to have my second baby, but I'm really out of shape. And will that matter much if I get pregnant? No matter whether you're getting pregnant or not getting pregnant, we really need to work on taking care of our bodies. That's one of the most powerful things you can do for your future, including your birth. So you don't need to start a HIIT routine or anything like that. But if I were you, I would make some small daily changes that helps yourself get healthy again. But I wouldn't use that as a reason to discourage yourself from having another baby. If you want to get pregnant, girl, get pregnant, but then take care of your body. Is there anything that doctors will try or suggest that you feel is unnecessary for baby after delivery? Here's the thing that doctors won't want you to do is to decide for yourself. They want you to do what's standard. And so the most powerful thing you can do is educate yourself. Educate yourself so that you know what you can and cannot say no to. And that's pretty much everything. But you also want to know, what should I refuse? Is this appropriate for me and my baby, or is it not? Because there's a lot of things we do that we will imply you have to do and you should do, and you're making a bad decision if you don't, but it's not necessarily true. So I would say that just about everything we do before and after birth, you need to understand that you can choose for yourself. Don't let me choose it. Don't let your doctor choose it. You choose it. This is your little person, and you have every right to make every decision for that baby. 38 weeks, my doc says induce at 39. I'm not high risk, no issues, my natural. First of all, if you are fine and baby is fine and you have no medical indication for induction, I would say hell to the no. That's ridiculous. I would not agree to that, especially if you don't want it. Now, if you want it, I'll support you and help you, but I wouldn't do it just because they say to do it. They'll try to get you to do it because guess what? They have more control over it if you're induced. God forbid you go in labor at the middle of the night and they have to leave their bed. I have cramps down there. It gets really bad. Should I be worried? So there's some things called lightning crotch, which can it's like exactly like lightning strikes your vagina. But you can have some cramping down there. You can also have some varicose veins and some different things, but you should not be worried. It's very normal. 40 weeks will be 41 weeks on Saturday. Just moved to Texas from Cali. No one will induce. So they don't want to induce you. Do I have to get an epidural or meds for labor, or can I go natural? Absolutely. You can go natural and get it if you need it. That's totally a question. Yes, don't rush baby unless, here's the thing. Everybody jokes that I'm crunchy with the side of medical. I'm not a huge fan of induction if you can avoid it, but if a mom really wants it, that's a whole different story, and we try to support her. How do you heal from birth trauma? Support and therapy. He's measuring 2 weeks ahead and really big, but no OB will accept me. There's a couple things you can do if you're really dead set. Number one, I would not worry about him measuring. They're always wrong, almost always wrong. Just show up to the hospital, girl. Just go to the hospital and tell them you think you're in labor. I know you don't think that. Go to the hospital, tell them you think you're in labor. You just moved, you don't have an OB, and you need help, and they're not going to send you home, more than likely. The resident OB will probably induce you. That's just what you're getting from me. Now, what I would recommend you do is you join the birth classes, start your labor bat signal, and let us help get your cervix ready before you do that. I'm pregnant with my second and on blood thinners. I was the same with baby number 6. Due to pee with my first, how can it affect labor? So more than likely what they're going to want to do is they're going to want to take you off of Lovenox around 36 weeks, put you on heparin. They're going to stop the heparin and want to induce you at 39 weeks. And you can always navigate those choices with your provider. Not pregnant, but I've had 2 high-risk babies, and I'm just here to say this is wonderful. Oh, thank you so much. What is considered low blood pressure, and it is a cause for concern 20 weeks today? Low or high pressure is relative to you. So for me, my blood pressures pregnant or all the time are very low. And so for me, it's not unusual for me to have 70 over 40. For someone else, that could be detrimentally low. So it's really important to know what your average is. And if it drops from that, then it needs to be looked at. Hey there, I hope you enjoyed this live Q&A with me. These are some questions that my followers on both Instagram and TikTok had for me. If you don't follow me on Instagram or TikTok, go do so. We have over 500,000 followers on all the social media accounts. It's such an honor. And we love answering your questions. We do live Q&As once a week, so you can ask us all the questions, and sometimes they'll make it over here on the podcast. I hope you enjoyed this episode. Hit subscribe, write a review, and as always, I'll see you again next Friday.